We are back with more health news right here on Health and Wellness Day on Mountain Connections. And right now we are going to talk about chronic kidney disease. This is another condition that isn't spoken about enough. We've got some great information for you. Let's take a look.
Approximately 37 million Americans are affected by chronic kidney disease, or CKD, and the vast majority don't even know it. Chronic kidney disease is a serious condition that often doesn't have any symptoms until it's advanced. But there's new hope for patients, and our guest, Dr. Neil Skolnik, professor of family and community medicine at the Sidney Kimmel Medical College of Thomas Jefferson University, is here to talk about the risk factors, diagnosis, and a new way to treat CKD. Welcome to Park City Television, Dr. Skolnik.
Christine, thanks so much for having me on to talk about this incredibly important topic.
Well, it's alarming to hear. What exactly is chronic kidney disease, and who is at risk?
Yeah, really good question. So chronic kidney disease occurs when the kidneys are no longer working adequately to filter the toxins out of our bloodstream that build up normally day to day. And you did such a nice job of pointing out how common it is, 37 million people in the United States, and the fact that most people who have it don't know they have it. And you're right, there are some groups that are at higher risk. So African Americans are at high risk. People with high blood pressure, people who have diabetes or obesity are all groups that are at higher than average risk. And one group that, and I don't think would be surprised is at higher risk, would be people as they get older, right? So if we look at people over 65, actually almost half, 40%, have chronic kidney disease. So there really are a lot of people in general who have it. And then, as you so nicely pointed out, some groups that are at particularly higher risk.
How exactly is CKD diagnosed, and why is that diagnosis so important?
So let me start with the second of those questions, which is why it's important. And for 20 years, we haven't had any new treatments for CKD, and now we do. And I'll come back to that in a minute, but that's why it's important that we start looking carefully at it. And the thing is, it's so easy to diagnose. So it's tragic that if we have it and don't know it, because then it progresses. And when it progresses, it puts us at higher risk of dying, higher risk of heart disease and stroke. But we can diagnose it early. And the way to diagnose it is with a simple blood test and a urine test that your doctor can order. So that's why it's an important thing for us to bring up with our doctor. Christine?
Absolutely. And I'm also curious, what can you tell us about the latest development in treating chronic kidney disease, or CKD, and why is it so important?
Well, CKD, as we talked about, is important. And we've been hoping for a new treatment for years. It's been over 20 years since there have been new treatments, but there have been a lot of activity in this area. There's been a lot of research, a lot of scientific development, all of which have culminated in the FDA approval of a new medication 2 weeks ago called Farxiga. Farxiga works on the kidneys to slow progression of chronic kidney disease, to stop it or slow it from getting worse. And that essentially is why it becomes so important now to look for chronic kidney disease. And that's why I decided to partner with AstraZeneca to get the word out about chronic kidney disease. Now, we know no medicine is right for everybody. You need to talk to your doctor about getting screened and what medicine is right for you. But there's this enormous opportunity now that was not here just a short time ago.
What advice do you have for patients with CKD or who think they might have chronic kidney disease?
Yeah, the core advice is to talk to your doctor, to bring up CKD with your doctor, because even as doctors, right, you have to realize we're people too. We're trying to take care of a lot of things for you. We're ordering the mammogram, we're ordering the colonoscopy, we're taking care of diabetes, hypertension, and lots of other things. And sometimes, not sometimes, Kristen, it helps all the time when we have this wonderful partnership between doctor and patient. And it's okay for you as a patient to say, hey, I heard about an entity that's important, chronic kidney disease. Do I have it? Should I get a blood test for it? For people who want more information, there's lots of information available. One place you can go for more information is forziga.com. So there's a lot that your listeners can do to help themselves and to help their doctors help them.
Well, thank you so much, Dr. Neil Skolnik, for talking with us today about chronic kidney disease and for giving us hope for patients and future patients and just this excellent information about CKD.
Thank you.